New this midday, May is Mental Health Awareness and Asian American Pacific Islander Heritage Month. And today, we're talking about what some experts call a mental health crisis in the AAPI community. ABC's Rena Roy explains why seeking help can often be stigmatized in the community and what some are doing to try to change that.
Growing up in a South Asian home, Dr. Dimple Patel of Chicago says she never knew much about therapy or mental health.
I didn't understand what depression looked like or what anxiety looked like because mental health was never really talked about. Like, oh, you're fine.
But she realized she was struggling after a car accident forced the then 21-year-old to take a step back from her college courses and stay home to recover.
I didn't know that I was experiencing anxiety. I wasn't eating, I wasn't sleeping, my heart was constantly racing.
So she secretly started seeing a therapist.
I was so afraid of being judged, what other people are going to say.
Speaking openly about mental health can often be considered taboo in the Asian American community.
Stigma is definitely a really big issue. Some of that has to do with cultural values and privacy and mental illness bringing sort of shame to oneself and one's family. Another big contributor is the model minority stereotype. This stereotype portrays Asian Americans as effortlessly successful. As AAPI, we can internalize that stereotype and start to believe that we need to be perfect.
Patel's mother battled that stigma herself and never got the help she needed, dying by suicide in 2011. 41% of Asian Americans are currently experiencing anxiety or depression symptoms, and 62% of those diagnosed with mental health conditions need help accessing services.
AAPI right now are hurting. We are experiencing three crises at once: the mental health pandemic that's happening right now, but also the rising tide of anti-Asian hate crimes, as well as sort of long-standing problems in the mental health system that don't meet AAPI where they're at.
Dr. Jeffrey Liu says there's a lack of translators and cross-cultural training in the mental health industry. Patel now doing her part to help bring more representation to the community as a therapist and advocate herself.
That's why I shared my story and my mom's, so I can raise the awareness of things like this do happen and we need to talk about it, and it's okay to ask for help.
Rena Roy, ABC News, New York.